Hey, what's up, everybody? Welcome back to another episode of Health Made Easy. I'm your host, Dr. Jason Jones, and today we're going to be talking about solutions for TMJD, or Temporomandibular Joint Dysfunction. We gave you some last time, but we're going to give you more today. And the reality is, we all want to smile, we all want to talk, we all want to eat, and we all want to laugh every single day without any issues. But if you have TMJD, those facial movements can cause you a lot of pain, and your temporomandibular joints, or your TMJs, are where your lower jaw and your skull meet. And if you have TMJD, including maybe a dislocation, arthritis, infection, or injury in the joint, or just not functioning correctly, you may suffer with painful clicking or locking or popping in your jaw neck. The neck muscles, get in there, and you start having neck pain, headaches, maybe even ringing in your ears. And although most symptoms of TMJ resolve relatively quickly for most people, sometimes they persist. They become aggravated by certain actions like chewing, swallowing, clenching, because the jaw is one of those joints where it just doesn't get a whole heck of a lot of rest because we're using it all the time. So some of the best solutions are what I'm going to cover today, and these are going to be non-surgical, okay? Because you always want to do non-surgical first before you do surgery, unless it's like some sort of significant trauma where that's the only thing that you can really do right now. Now, exercising your jaw. So when you exercise your jaw daily, it helps increase mobility of the joints. You can try to stretching exercises, relaxation exercises. There's even strengthening exercises that relieve TMJD. There are certain ones that we give out to our patients. Now, correcting your posture is another way to do it. Your posture actually affects the TMJ. When you sit in a position that's not ideal for a long period of time, especially with your head hanging forward, it puts a lot of stress on the jaw. So a simple solution to help relieve some TMJD is just to correct your posture. So when you're working, always choose a chair that has back support. You're sitting upright, your head's over top of your shoulders. Maybe take some breaks, stretch it out. While you're driving, sit up really straight. While doing, even leisure activities such as watching TV or reading, try to sit up straight. Use a pillow behind your back for support. So also try a simple exercise to correct your posture. Push your chest out, pull your shoulders back, and gently squeeze your shoulder blades together. And this will help to engage those postural muscles, because the more you engage them, the more endurance you put in there, the longer they're going to last when you need them to. Reducing stress and getting a good night's sleep. Now, stress stiffens the jaw up. It worsens TMJ. You can certainly try meditation or yoga practices to put less stress on your muscles, but you also can work, in the garden, to calm your mind or relax your muscles. Everybody calms down and relaxes it differently. Now, generally, sleep is super important for overall health, but to minimize TMJD, it's advisable to sleep on your back with a pillow to support your neck. And the reason is, if you sleep on your stomach or you sleep on your side, it's going to push your jaw over. Now, avoiding foods and certain activities. Now, some foods will force your mouth open too far, and it also are much harder to chew certain foods. So foods that require a lot of chewing time, which in the grand scheme of things is actually really good for you, like steak, where you have to really force the jaw to work really, really well. That's actually a really good thing. But if you're suffering with TMJD, you kind of want to avoid that until the jaw is actually better. Crunchy or hard foods can be very tough. Chewing gum on a regular basis, that can also aggravate it as well. And then also, when you take really large bites of food, that also has an impact too. So just smaller bites. You can also try to minimize activities like yelling or yawning. Quit bad habits such as like biting your nails, clenching your teeth, chewing on your, lips and cheek, that sometimes people do, and grinding your teeth. So anything that's aggravating it, you definitely is a good idea to avoid those until it starts to heal up and get better. Just kind of keep note of your daily pattern. Just kind of jot them down, because the more aware you are of something, the less likely it is that you're going to repeat it. But it also works good for the things that you want to do. If you want to do something or improve something, the more aware you are of it, the more likely you are, and the more it's top of mind, the more likely it is that you're actually going to do it. So, hope you love this series. I sure did. This is Dr. Jason Jones signing out. We'll see you guys next time. Bye-bye.